Charlotte,
Yes.
Richmond,
Yes.
on the 66.
64.
64, that's true.
Yeah. Yeah.
We're going to go ahead and get started.
Okay.
Good evening. I'd like to welcome everyone to the COVID-19 Vaccine Facts Not Fear Vaccine Safety Webinar for Healthcare Providers for December 29th, 2020. My name is Donald Moore, and I'm with the Virginia Department of Health.
Well, good afternoon. I'd like to, Donald, do you want me to take over?
A few admin announcements real quick, and then I'll turn it over to you, Dr. The discussion format is 45 minutes of moderator-asked questions of the expert panelists and 15 minutes of Q&A from attendees using the chat functionality. Attendees who join by telephone who have questions should send their questions to epnrtraining@vdh.virginia.gov. Your feedback is requested regarding the panel discussion webinars. Please complete the survey. It's in the chat box. Your experts panel for the evening is as follows. Dr. Norm Oliver, Commissioner, Virginia Department of Health. Dr. Josh Crawford, Bon Secours Health System, Co-Chair, VDH Vaccine Advisory Work Group, Safety and Efficacy Subgroup. Dr. Kelly Good, Professor of Pharmacotherapy and Outcomes Science, VCU Health of Pharmacy. Anthony Buffo-Bonney, Associate Professor of Medicine, Infectious Diseases, VTC School of Medicine, and Director of Infection Control and Prevention, Carilion Clinic. Your moderator is Stephanie Wewell, Director of Pharmacy Services, Virginia Department of Health. I'll now turn it over to Stephanie.
Thank you, and welcome. I'm excited to have this opportunity and look forward to talking to our panelists. So if that's okay, we'll get started with a few questions. First, let me kick it off to Dr. Oliver. And Dr. Oliver, can you tell us a little bit about the COVID numbers in Virginia?
Yes, I'd love to do that. Before I do, though, one thing I wanted to say about the folks who are here joining us today, pharmacists, pharmacy techs, and others involved in the pharmacy provision of pharmacy services to clients around the Commonwealth. I wanted to thank you for your partnership, both in terms of fighting the COVID-19 pandemic, but prior to that, the ongoing partnership that we've experienced as a public health department with people in pharmacy. The pharmacists have really consistently contributed to the population health and public health efforts. And once again, you're showing that with the COVID-19 pandemic. You've shown it in the past. The last pandemic we had, the H1N1 pandemic, and on an ongoing basis every year with the flu vaccinations that we carry out. I think the work that you do in your pharmacies has helped to ensure that we get as many people as possible vaccinated for all of these communicable diseases, and we're really looking forward to partnering with you in the effective implementation of this vaccination campaign around COVID-19. As you all know, we are experiencing another surge in COVID-19 incidents in the Commonwealth. We have pretty widespread community transmission of the disease in virtually every sector, every section of the Commonwealth. It's particularly bad in the far southwest part of the Commonwealth, but every region of the Commonwealth is experiencing these big outbreaks. We are having more incidents of COVID-19 currently than we have even last spring, when we thought we were seeing a big surge then. the case incidence that we're seeing right now is about around 6 times that what we were seeing back in April and May. When I checked it earlier today, we were somewhere around approaching, in most regions, 50 cases per 100,000, whereas we were around 9 or so cases per 100,000 back in the spring, and it's in the 70s and approaching 80 per 100,000 in far southwest. The case incidence being that high has led to increased outbreaks in long-term care facilities, in schools, and in other congregate sort of settings. Those things reflect the community incidents, and the only way to really cut down on those kinds of outbreaks is to do something about that incidence. That sort of sets the stage, I think, for the vaccination campaign, which we want to focus on tonight. When we're having this sort of case incidence, doing the case investigation, contact tracing that we do throughout the pandemic becomes much more challenging. There's too many cases to follow up on all of those contacts in a very effective manner. Thankfully, we now have 2 effective and safe vaccines that we can use, and those will be the ones that we'll really focus on over the next ensuing months to try to get a handle on stamping down the spread of COVID-19. Stephanie, I didn't know, did you want me to say something about the phases that are being projected?
Sure. Yeah, if you want to talk through the different phases of the vaccine distribution and how we will be following the allocation tiers.
Right. So the CDC's Advisory Committee for Immunization Practices, ACIP, has made recommendations for a phased approach to the vaccination campaign for COVID-19. In phase 1A, the ACIP and CDC recommended that we vaccinate healthcare workers in healthcare systems, as well as healthcare professionals in community settings. And that's a particular subset of the essential worker category. The idea here, of course, is that, I mean, it's like before COVID, remember when we used to fly on airplanes, the flight attendant would tell you that in the case that you needed oxygen, the mask would come down, and be sure to put the mask on yourself before you help somebody else. Well, this is society's way of recognizing the healthcare professionals are the ones we need to protect first, because if we get sick, we need someone there to take care of us, and we want to ensure that they're safe. So those essential workers in healthcare, both in healthcare systems and in communities, would be in phase 1A. And in addition, we would do residents of long-term care facilities, skilled nursing facilities, and long-term care facilities. That number in the Commonwealth is about 500,000 people. And that's the cohort that we're vaccinating now. ACIP has made a recommendation about a week or so ago for phase 1B. Phase 1B would be other essential workers. And as they did with the long-term care facilities, they also recommended dealing with a high-risk population that wasn't necessarily part of this essential workers category. And that population for phase 1B is people age 75 or older. They provided a list of these other essential workers, but they didn't prioritize that list. We have tried to come up with a prioritization of that, and that's being discussed in our vaccine advisory work group to get their input on it, and then also in our medical advisory council. And once we have their input, we'll put together a prioritization list, which will go to the Secretary of Health and the governor. And I suspect very shortly will be coming out with a recommendation on that list. And I can tell you that it includes all the other associated healthcare workers like home health, child welfare, adult welfare, adult protective services, that sort of thing, law enforcement, correctional facilities, teachers for K through 12. There's a whole list of people there, but expect to see that in the next week or so. So I'll leave it at that.
Thank you, Dr. Oliver. And I just want to back up for just a second, because I think in the last 5 minutes or so, we've had about 25 people join. So first of all, I want to just thank everyone again and echo Dr. Oliver's remarks on just the importance and the recognition of our pharmacist community. You all have really shown some dedication throughout this pandemic and been willing to assist VDH in a lot of our measures to try to mitigate and contain this pandemic. So thanks, Dr. Oliver, for helping set the stage and talk through the numbers of COVID-19, specifically the rates right now, and also the different phases. I think it's certainly a good segue into talking about vaccine with us seeing such a high transmission rate. And I guess, Dr. Bafuboni, if we could talk a little bit, I feel like people are certainly concerned that this vaccine was approved. If we can just talk a little bit about the FDA process and EUA status, and so that it was approved so quickly while other vaccines take quite a bit of time. Can you talk about the EUA process and any risk associated with it compared with the usual approval process?
Thank you very much for having me, Stephanie, and everybody here. So I'm speaking from Roanoke in Virginia. Hi to everybody. So the EUA process, is the emergency use authorization process, is certainly different in some ways from the regular approval process. The regular approval process would, in terms of FDA approvals for medications, there is the determination that there is substantial evidence of benefit and no untoward side effects, and then the medication or a device is approved. In September 11th, 2001, following the events on September 11th, the FDA got new powers to be able to approve medications using emergency use authorization. And the thought was that if there was a medication that was thought to be effective and the benefit would outweigh the risk, then one would use it. However, for vaccines, that bar is actually markedly higher. So for vaccines, there has to be a clear and compelling evidence of effectiveness, which is usually obtained through a well-designed study, phase 1, phase 2, phase 3. And then with that, if there is no safety issues with it, that is when it is approved. So it's almost akin to the process for regular approval, the difference being the follow-up period. So just as a general description, both Moderna and the Pfizer vaccines would have gone through the phase 1 trials for determining, safety in small number of population. And then they would undergo, just like any other vaccine would in a regular setting, phase 2 trials as well. That would look at more populations, different populations, look at different doses, and would then undergo phase 3 trials, which would look at thousands of patients. I think the Moderna, and I could misquote on these numbers, so don't take one looked at 46,000 patients, and another looked at 30,000 patients. So these are very large numbers of patients that were looked at, consistent with what would be looked at in regular in any regular approval process. What though is different when after the Data Safety Monitoring Board reviewed and found that these vaccines were not at predetermined duration, were not didn't have any safety concerns and had appropriate effectiveness, was then you had the it's called the biologics group, the vaccines and related biologics products. These are a group of external scientists who are not related to or have any skin in the game in terms of the FDA and or do not have any conflicts of interest. They review the data as well, make sure that there is appropriate benefit. It's effective like it says it's going to be. Here they found between 94 and 95% effectiveness. And then they also look at the safety data as well to make sure that there are no abnormal signals. Now, the timing for this meeting, the Vaccines and Biologics Products Advisory Committee was, they looked at, usually in the standard process, you wait about 6 months to 1 year after after your last case has been enrolled before you have these meetings. But with the EUA, they made sure that at least half of all the persons who were in the trials had gone at least 2 months outside of their last dose to make sure that any side effects were looked at. And that's the only difference really between the regular process and then the EUA process. So for vaccines, this seems to be a very well thought through and carefully planned process to limit side effects or to limit not finding any untoward effects. And then on the back end, they do what we call post-authorization monitoring using different systems, the vaccine adverse event system, as well as the VSafe system, so that persons who have been immunized will still be able to report if there are any untoward side effects as well.
Thank you. That was a comprehensive overview of the EUA process, and I think that we can, if we'll move on a little bit to talking about vaccine efficacy. I do have to say we've got quite a few questions to go through. So, Dr. Crawford, can you provide some information on how the mRNA vaccines work? Dr. Oliver talked about the 2 vaccines that have been approved, the Moderna and Pfizer, which are both mRNA, and then maybe highlight a few differences between the 2.
Yeah, sure. Thanks. And a little bit to piggyback on what was said earlier, when I was researching this for CE, we did, and both the Pfizer and Moderna vaccine, for example, have been studied in more patients than like the Shingrix vaccine was or Fluzone high dose prior to FDA full approval. So yes, time is not necessarily on our side, but the robustness of the studies I think are important to point out to people. So these are pretty interesting vaccines. They utilize this new mRNA technology that we're hearing about, which actually started being developed in 1990. The first publication of its use in animals was in 1990. The issue was the mRNA rapidly degrades once it's in the body. So it took a few years, I guess 30 years, to develop a viable coating. And in this particular case, these are lipid coatings that will allow the mRNA to get into the cell. So essentially, when the mRNA enters the cell, it travels to the cytoplasm, which houses ribosomes. Ribosomes read this mRNA protein. They follow the encoded instructions. and they produce a viral antigen protein from within the cell. And in this particular case, it is to the spike protein component of the SARS-CoV-2 virus. And then that includes, hopefully, natural post-translational modifications. And why that's important is because this really mimics the process by which natural viral infections occur, where the information from the viral genome is used to produce viral proteins from within the cell. This is potential. This is the theory behind it, but this potentially enhances immune response because it may include an improved B and T cell responses. And so that's why I think these are really exciting. I think kind of more of a layman's term, maybe the way to explain to patients are that mRNA is like instructions. They're kind of like software being loaded to a computer or an app being loaded to a cell phone. And then once you're inside once they're inside the cell, our human body and biology really just takes over. So they're fairly, they're really neat. I think a few things that we've been asked that are important to go over. These are not live viruses. There is no risk of catching COVID by getting one of these vaccines. The mRNA does not enter the nucleus of the cell, so it doesn't interact with our DNA. And so there should not be any way for this mRNA to incorporate into our DNA. I know I've been asked that before. And these are really just instructions again. So it's really, really, I think, a neat technology. From a different standpoint, the studies are very similarly designed. They're well done. Two different companies make these. The dose is a little bit different. Pfizer is a 0.3 ml vaccine. Moderna is a 0.5 ml vaccine. There's some logistical differences from storage and transportation. But for the most part, they're very similar. They had similar efficacy, and they also had very similar safety profiles. So they're not technically interchangeable. So if you get one, you should complete the series with the same one. But really, I don't think it matters which vaccine you get between these two. They're really almost identical.
Thank you, Dr. Crawford. I know that you and Dr. Goode have been in the thick of it. We've been working closely within the health systems to get vaccine, and Dr. Goode has been helping to administer some COVID vaccine today. Dr. Goode, can you talk about some clinical considerations for both Pfizer and Moderna, including storage, preparation, dosing, and any post-vaccine monitoring?
Yeah, thanks, Stephanie. So Josh talked a lot about the difference in the storage a little bit and the dosing. But basically, Pfizer is going to be an ultra cold frozen vaccine. It comes undiluted, so it has to be mixed. It has to be thawed and then diluted before administration, where the Moderna vaccine comes already diluted, but it does also it's a frozen vaccine, but at a regular frozen temperature. And then it still has to be thawed before administration. The Pfizer vaccine is going to have only 5 doses of that 0.3 that Josh talked about, where the Moderna has 10 doses of a 0.5 ml dosing that's given. So depending upon the vaccine you're giving, you need to understand the differences in the storage and the thawing of the vaccines and making sure that you're following the different rules. They each have different storage for staying at room temperature. So you need to make sure that you're following that and that you're administering the correct dose. And as Josh said, that you want to stick with the same vaccine, and the Pfizer vaccine is given 21 days apart, whereas the Moderna vaccine is given 28 days apart. There is some wiggle room, as if you're familiar with vaccine science, typical for all vaccines that ACIP is recommending. They give you sort of a 4-day window before or after that vaccine. So if they don't comment on exactly that 21 day or that 28 day, then you can certainly still administer the vaccine. When we look at some of the precautions in monitoring, you do need to monitor everyone for 15 minutes. If people have a history of allergies or anaphylaxis for both vaccines, you're going to want to monitor that person for 30 minutes. So adhering to that and making sure that you're really monitoring those individuals is very important with both those vaccines. And I think I got everything you asked for preparations, storage, and monitoring, Stephanie. Thank you.
No, that was a long question. Thank you. So, Dr. Crawford, you've been working with the Vaccine Advisory Work Group and specifically safety and efficacy. Can you talk a little bit about the most common side effects that are likely to occur from either one of these vaccines? looks like you're on mute.
Okay, off mute now. Thank you for reminding me. So both the studies, Pfizer, Moderna vaccine studies, they both looked at basically the same types of side effects. The main ones that they did, and if you read the studies in detail, you'll see solicited versus unsolicited. So solicited was where study participants had to answer yes or no. Do you have a fever? Yes or no. Are you experiencing fatigue? Yes or no. And then that was kind of a subset that was looked at more closely in these studies. And then you'll see unsolicited. So these are longer term vaccine reaction, usually 7 days or more out, in which that's just to kind of orient you if you read the studies to what solicited versus unsolicited mostly means. So when we look at the solicited, that's what our patients are probably going to be experiencing most likely immediately afterwards. And the studies, again, very similar results. So after the first dose, you'll see some potential for, actually a lower potential for fever, fatigue, headache, chills, muscle pain, joint pain, and antipyretic use are all the things that they looked for specifically. And I think the key takeaway is that they also looked at these after the second dose. Following the second dose, when compared to placebo, that's really where you saw a lot of these more systemic side effects of fever, about 16% of patients, fatigue, about 60% of patients. And that's any level of fatigue. So it doesn't necessarily mean fatigue, you can't go to work that day, just some level of fatigue, more than normal baseline. About 50% of people reported headache, 35% chills, 37% muscle pain, 22% joint pain, and about half the participants reported antipyretic use in the studies. Now, one key thing to remember is that after the second dose, you'll see more systemic side effects than after the first dose. Now, the placebo groups did actually have a fair amount of systemic side effects, despite just being saline placebo. But then what they also studied in Pfizer, they looked at specifically adverse events in 55 and up patients. Moderna looked at 65 and up patients. And in both studies across the board, all of these side effects still occurred, but at lower rates than in the 18 to 55 or 18 to 65 population. So I think that's the other kind of key takeaway. The other thing to remember is that these were transient. The typical onset was 1 to 2 days post-vaccine, and then they lasted for about a day. So these are not side effects that are going to hopefully keep people out of work for a long period of time or anything of that nature. And so again, they were lower in older, elderly 55, 65 and up patients, however you define that. But efficacy was similar across both of those groups. Efficacy was similar for 18 to 55 and 55 and older patients. So I think that's really important to remember. Now, injection site reactions, haven't really heard a lot of those, true reaction or anything of that nature, but I think just about everybody I've talked to said that their arms are a little more sore than a normal vaccine. And that's anecdotal, I know. I don't really like anecdotal evidence, but I've asked a dozen people I know that got a vaccine, and they all said the same thing. Yeah, my arm hurt more than usual after a vaccine for about a day or two. So I think those are good counseling points for patients to remember.
Great, thank you. And I think that, certainly we can talk, there's information that we built out on our website, information from the clinical trials, as well as ways in which they can be tracked through either VSafe and VAERS. In the interest of, I'm going to move on. I don't want to completely skip that point, but just we can talk about that a little bit more if we have time at the end. Dr. Raffo-Bonney, can you talk a little bit about special populations and what your thoughts are on the allergic reactions we're hearing about?
Okay, thank you very much for this question. So I think I'll piggyback on Joshua's statements and say that it's important to always give anticipatory guidance with regards to when vaccinating, so people are not sort of weirded out. These symptoms are very mild. I got my vaccine. I don't even remember the day I got it because it was so uneventful for me. No pain or nothing. But again, that's a one case. So we have had some reports of people having anaphylaxis. I think we can count the number of those reports, and because it tends to be quite a dramatic symptom, we get a lot of media coverage on it. In the US, there have been 2 million vaccinations to date, or probably more than that. and I don't think I can count more than 5 or so of these rather severe reactions, and it's difficult to tell whether it's all even related to the vaccine at all. That's number one. Of course, these vaccine adverse event reporting systems will keep an eye on that so we can make sense of it. And then there is these Bell's palsy has been described in some people. The data from FDA, FDA was aware of this and have looked at it. The thought was this could be related to a difference in the background, the difference in background at the time of study enrollment. But again, these specific side effects are being looked at very carefully through the vaccine process. When it comes to different populations, like the pregnant, immunocompromised, and whether they need to be vaccinated or not, I think we need to use data as well as what is happening on the ground to advise us. Yes, there is scanty data on pregnancy and these vaccines. At present, we know Moderna did study in animal models any fetal toxicity and did not find anything. We know that some people got pregnant during the trials and have been looked at, and we are not finding any abnormal signals there. But the numbers are small. We also know that we have healthcare workers who can be working with COVID and can get sick and very sick if they get the real disease. So it is important in those settings to have discussions with one's primary care provider and make decisions as to whether the risk benefit, look at the risk benefit ratio. For my wife, I would probably suggest, hey, go ahead and get it because she's a nurse as well. With regards to immunocompromise, we did find that HIV stable and there were no issues there. It wasn't really studied in people on significant immunosuppressive agents or uncontrolled HIV. It does not mean it cannot be used. It simply means there is not enough information. And so if the person desires, there should be appropriate counseling, and that there is that lack of data. And if they get it, they should therefore not decide to stop masking, social distancing, and practice the right things, because there isn't much data on the effectivity or effectiveness there as well.
Thank you. If someone has already had the COVID infection, should they still get vaccinated?
Yes. We currently think that when you do get COVID infection, natural immunity may give you up to about 90 days of immunity. That's our current thinking. We don't know much beyond that for now. There were some people who got COVID or were found to have had COVID and completed the vaccine series in the studies, and there were no untoward effect. And the thought is that with getting the vaccine, one's immunity may certainly extend beyond the 3 months. And so it makes sense to get it. If the person wishes to wait for 90 days and then go on to get it, that's fine. I would not advise getting the vaccine whilst you are actively sick with COVID, because you could infect the person giving it to you. I would advise, if you desire it, you get it after you've come out of isolation, and then you get it at that time.
Thank you. Dr. Oliver, can you talk a little bit about the mechanism for tracking the vaccine administration as well as the second dose reminders?
Yes, so the Virginia Department of Health runs the Virginia Immunization System, VIS, which is the registry for vaccination in the Commonwealth. Everyone who receives a vaccine will have that entered into the VIS, and this will allow us then to track that vaccination, know when people got their first dose, and be able to follow up with them for their second dose. At the time that they receive their first dose, they are to receive or supposed to receive a card reminding them that the date, time, place, and the vaccine that they received with that initial dose. We are asking people if they have smartphones, which probably 80% of adults do, that they enter that information into their phone, so that can be another reminder for them getting their second dose. And of course, through the VIS, we'll be able to reach out and remind them ourselves. CDC has a tracking system, VTRAX. We have interoperable connection between our registry and VTRAX, so that's another way in which we'll be able to track people who've been vaccinated. So we have our electronic means of tracking them. We will provide them with some paper to remind them of it. We will ask that they use their smartphones, and we will reach out to them for their second dose. And in those ways, we will ensure that people get the second dose, which we know is necessary to reach that 95% efficacy rate.
Yeah, thank you, Dr. Oliver. I have to say, I've enjoyed some of the social media posts with people holding their second dose cards. It's exciting. So I feel like this is a good transition to start talking a little bit about the pharmacy partnerships and how we can work with our community pharmacies as well as our pharmacists, pharmacies, long-term care facility pharmacies, and so on. Dr. Goode, you've helped us a little bit as we've been discussing our statewide pharmacy partnership, and I'd like for you to talk to the group and help explain how pharmacists will be involved in the process in the statewide pharmacy partnership.
Yeah, thanks, Stephanie. And I think pharmacists can play a huge role. And so when we look at VDH and trying to roll out vaccine across the Commonwealth, you heard Dr. Oliver talk a little bit about the numbers in phase 1 of the 500,000 people to get vaccinated, and pharmacists can help play a role in getting those vaccinations delivered in phase 1. And so really we're looking for pharmacies and pharmacists who are willing to partner with VDH to sort of help deliver those vaccines during phase 1. So that's the initial opportunity to really get involved with vaccines. And there's a survey that you can complete to show your interest for doing that. And basically you'll be working with the way the state's going to do this. Dr. Oliver laid out sort of the phases, and the next phases haven't quite yet been approved or by the governor yet. But during this phase 1A, you can apply to work with the health districts. So VDH sort of is doing the overarching piece, and then the health districts are responsible for getting out the vaccine from their health districts. So pharmacists will start at the VDH level, complete the survey, and so that they can be administering vaccines in closed pods. So this is not open season for anybody who wants to come in and get the vaccine, but the health districts will help coordinate with the pharmacist on which people should get vaccinated, whether it's community providers, maybe physician practice or dentist practice that aren't going to receive lots of vaccine would come to the pharmacy to get vaccinated, or the pharmacist might go into a nursing home facility or an adult living facility and provide the vaccine and help the health districts get those vaccines out. So the steps are going to be first that survey of interest, and then you'll go through and do a sort of a memorandum of understanding with VDH on that you are interested, that you are willing to do the partnership, and then you're going to register through VARIP, which is the vaccine registration. I forget what he's for, but the vaccine registration platform where you'll go in and sign up and do a provider intent. And then once you've done that, you'll be queued up to get a CDC provider agreement intent form, and then you'll get that, and you'll have to register to be part of that, and then you'll finish up with making sure that you're registered for VTRAX, and that you also definitely have to be registered with the vaccine Virginia Immunization Information System. So there are a lot of different steps and a lot of different pieces, and VDH has put together a frequently asked questions that will have all these links to be able to make sure that you're doing all the steps that you need to do that. And then your name will be sent to the local health districts so that they can contact you for help. And I think, Stephanie, did I get everything?
You did. You did a great job. I feel like I can share a little bit of numbers. So we started this last week and talking with pharmacies, or maybe 2 weeks ago. And I think that, we've certainly worked with Virginia Pharmacists Association on helping to identify pharmacy contacts and partners, and have been talking to many chain and community pharmacies throughout the state. We have, as of today, I think we had over 120 agreements signed. That's phenomenal. It's just wonderful to see such a large degree of participation and willingness to help. And then of those, there's about 80 of those have completed that CDC agreement and are fully enrolled and ready to go. So we certainly want to work with our pharmacies to get them enrolled. And I feel like this is probably a really good time to kind of transition. We talked a little bit about the state pharmacy partnership, but then there's also the federal pharmacy partnership. And I think that can be really confusing. So can you talk a little bit about, Dr. Goode, about the differences between the two and how that works with the federal partnership?
Yeah, so the federal partnership, the Centers for Disease Control has partnered with Walgreens and CVS to deliver vaccines to the long-term care facilities. And so that's a separate partnership, and we don't know when that's going to launch quite yet in Virginia, in the Commonwealth, but that's a partnership that will help get those long-term care facilities vaccinated and for the initial vaccines. But then, as we know, there are different people that come into those facilities, and then the state's going to be responsible for making sure that those people are vaccinated. So the local health districts will have to do some of that catch up. So that's a separate piece. So you could be enrolled with the federal partnership, but also with the state. There's also, the CDC has partnered with something called the CPSN, which is independent pharmacies and some chain pharmacies that are smaller chains, to also work in that long-term care partnership under a federal agreement. But the state is looking for partners that would be separate. You can do both, or if you just want to partner with the federal piece, that's fine as well. But the state's going to have to pick up all the pieces that aren't done under that sort of federal partnership. So that's really important that we have other people who are at risk that need to be vaccinated that wouldn't be covered under those long-term care facilities or even after that first round.
Thank you, Kelly. And I know Dr. Oliver can echo this, but our health districts are extremely interested in having some help and assistance as they work to vaccinate within phase 1 these targeted populations. So it's extremely helpful as we talk through this that we explain the way in which the both state and federal pharmacy partnership works. Are there any other steps that pharmacists should follow to help prepare for to receive the COVID vaccine, Dr. Goode?
Yeah, so I think you really just want to make sure that you've had your training, that you're up to date on continuing education, which is an extra 2 hours, that you have your CPR, that you have storage. I think storage facilities are really important, and making sure that you're having continuous data logging monitor for your temperatures and able to react if you have an issue there, that you have your proper PPE for administration, and that you've done all the pieces for logging the data and making sure you're tracking the vaccine you're submitting to the immunization information system, and that you have the correct forms for the vaccine. Each one has a screening form and information for patients, and that you have all the things that you would need to be able to have the forms available to do those. So it's a stepwise process, very similar to other immunizations, but there are a few differences with the COVID-19 vaccine that you want to make sure that you're involved with getting all of those pieces in place.
Thank you. Dr. Crawford, can you talk a little bit about what pharmacists can do to help with vaccine hesitancy?
Sure. I think one thing would be to get vaccinated once it's available, to pharmacists. Obviously, walk the walk, not just talk the talk. And then just try to go over side effects to expect. I think reassuring people that, look up some of the myths that people are hearing and try to figure out, how to counter some of those. The University of Facebook is very powerful, unfortunately, and we do have to try to combat some of those myths that are out there that keep persisting. And that's one thing that I did when we've given presentation to our health system employees, was just try to dispel some of those common myths and be realistic with people. And I think the other thing that is nice to point out is that this is not a super new technology. It has been developed for 30 years, which is a fairly long time in science. This really just sped things up quite a bit. And that, again, fairly safe, low side effects overall. It's one of the most efficacious vaccines that I think we've ever developed in the world. So that's helpful to know. And of course, also just that COVID is real. I mean, I even still have family members that don't think it's all that severe. And I think our health system, like 20% of our beds are COVID patients right now, and so it's real, it's here. And I don't know, it's very frustrating though. I do share everyone's frustrations and just combating some of these myths and how hard it is for people to try to understand the reality. But yeah, super effective vaccine. Very safe, and even maybe compare some of those numbers to other vaccines that people wait in line for. Like Shingrix, you probably have a 6-month waiting list to get a Shingrix vaccine for it's not even a lethal disease for the most part. It's just, so I don't know. I don't know if that helps, but those are some of the things that I've tried to do when speaking with others.
Thank you. So before we move on to questions in the chat, and certainly if you have any, feel free to add those in. And but let me just talk a little or get some ideas from Dr. Oliver. You want to talk a little bit about the vaccines that are in the pipeline for approval? Maybe what's coming next?
I got my fingers and toes crossed that we get more. The vaccines, as great as they are, have been coming to us in a relatively limited quantity. I mean, they're scarce, right? We have 500,000 people to do in phase 1, and we've received maybe a couple hundred, 280,000 doses so far. We're getting about 100,000 doses a week. At this rate, we're going to be finishing phase 1 mid to late January. Phase 1B, we are talking about another 1.5 million people or so. We need more vaccines. We need Pfizer and Moderna, hopefully, to step up their production. And hopefully AstraZeneca, Johnson & Johnson, and Novavax will complete their clinical trials and come up with additional vaccines that are both safe and effective. I'm also hoping that I think it's only the Johnson & Johnson one that is a single dose, which would also be really a godsend if we could get that and get it in large quantities. I wanted to underscore something that was said earlier about the importance of the partnership between pharmacists and public health on this. As we branch out to wider and wider swaths of the population, your ability to vaccinate is going to become critical for us to be able to reach the rest of that population. At most, the health department is going to be able to get about a third of that population, and I think the work that you do will ensure that we really get the numbers that we need to have actually vaccinated in the Commonwealth. You know as well as I do, the vaccines don't cure people, but vaccination does. And so that's going to be key. We can actually vaccinate people. So I'm looking forward to partnering with you on that.
Thank you, Dr. Oliver. I feel like we've got about 10 minutes, so we'll turn it over to Dr. Klein, and if you want to take a few questions and answers.
Sure. Thank you. For a very quick thank you to our panelists and to everyone who is attending tonight. We're very grateful for your presence. I'm going to sift through a couple of these questions. There are several that relate to where people will get their own vaccinations. The question, where can frontline pharmacy staff go to get vaccinated? And how will VDH notify healthcare professionals, including pharmacists, who are not part of large healthcare systems, that vaccines are available? What is the mechanism? How will they be notified? Dr. Oliver?
Stephanie may know the details on that better than I do.
So I'm happy to talk a little bit about it, and then Dr. Oliver, if you want to tag in anything that I left out. I will say that we have on our website, which I did put in the chat, but if you go to www.vdh.virginia.gov, for those of you that are listening via phone, then right there front and center in a blue box says vaccination, and you can visit that, but it has a timeline, and it lists phase 1A, which is healthcare personnel and long-term care facility residents. Below that, it also provides the guidance that was issued by the Cybersecurity and Infrastructure Security Agency. So it's CISA, and it provides detailed occupational definitions for that phase 1A. But if you click within that phase 1A, you'll see all the healthcare providers, anyone who's paid or unpaid that could be directly exposed to COVID within the healthcare center, and then also long-term care residents and staff. So that is phase 1A. That's where we are right now in vaccinating. And as far as where you can receive that vaccine, it's really, you need to contact your local health department. So the local health departments are providing this vaccine at the community level, and within your community, you need to contact your local health department, and they will help guide you to the vaccination clinics that are available.
Okay. And there was a question, hold on, sorry. As a dentist, I'm a dentist, can I deliver vaccines? I don't believe I can deliver vaccines. Is that correct?
At this point, that's correct. We have not extended the vaccinations to dentists or dental hygienists. And there's some other categories that aren't included at this point.
Here's a very specific question about establishing the partnership. You know, once pharmacy signs the agreements, after the DocuSign agreement is signed, how long will it take before vaccine will arrive? Dr. Good, I think, would you know that?
So I can start, and then Stephanie can help me if it's not exactly correct. So once all the forms and everything have been signed, then that information will be supplied from Virginia Department of Health to the local health districts where the pharmacy resides. Locations of they're even looking at borders. So if you're closer to one health district that might need help, then your pharmacy name and information would go to that health district, and then it's up to the health districts to contact the pharmacy about their needs and begin to ship vaccine based on that health district's needs. So you won't automatically get vaccine once those forms are complete. The process is that those health districts are provided with that information, and then they're responsible for contacting the pharmacies and pharmacists if they need help.
And when you say health district, you mean local health department?
Correct.
Right. So there's within Virginia, I think this is a good clarification. Within Virginia, there are 35 health districts. There are over 100 health departments. So each health district is planning for that area, which may have multiple health departments. And if you go to, again, the VDH .virginia.gov website, it has a health department finder, so you can find your local health department within your area. If you contact them, then they'll certainly put you in touch with the right area. But the point is, on the actual agreement or the statewide pharmacy partnership, you don't have to contact them. They will contact you. And this isn't meant to be a binding agreement as much as this is a partnership. So they want to work with the pharmacy as they're able to. And again, I think I just need to reiterate with what Dr. Oliver said. There's not a ton of vaccine available. So they've got to find the providers who can help with the outreach that works within the community and what they've identified. And so they will reach out to pharmacies and providers as they identify their needs.
Thank you. Any other feedback on that? I think this is such a massive undertaking that is evolving as we speak. So we have to all work together. A question that comes up. Sorry, go ahead, Stephanie.
Yeah, Dr. Coleman, I just wanted to reiterate, because I think that there was a good question there that I somewhat glossed over, and it's how will we know how, what the vaccine process is as far as who can get vaccinated and where, and how will that communication continue to develop. And so VDH is continuing to work on that and ways in which we can effectively get our communication out to all of our population. And I think that, certainly we will continue to host some of these large telebriefings. Dr. Oliver has been a big part in just really making sure that we can get this information out through these massive telebriefings. We'll continue with our messaging, and we'll continue to have conversations like this.
Okay, let me get through a couple of other questions. A question that comes up over and over is, how long does it take before someone is covered once they have their vaccine? And I know that Dr. Oliver answered this, but can you just reiterate, if I get my second dose of vaccine, can I go out and party?
So couple of things on that last question. Know that the vaccine protects you from getting COVID-19. We don't have sufficient data in yet to say definitively that the vaccine stops the spread of SARS-CoV-2. That's one point. The second point is, until we have the overwhelming majority of adults vaccinated against this virus, it will still be spreading. So for both of those reasons, after you get your vaccine, you should continue the non-pharmaceutical measures to prevent the spread of the vaccine. You need to wear a mask, you need to wash your hands, you need to watch your distance, and maintain physical distancing with people. Otherwise, we'll continue to see the spread of the virus.
Okay, and Dr. Crawford, you addressed the question that was posed. If you want to clarify it, if a person misses their second dose or misses it by a few days, what then? Or if they miss it altogether, what do we do about that?
Yeah, so ACIP somewhat addressed this. They said, for Pfizer, it's 17 to 21 days afterwards you should get your second dose, and Moderna's, again, plus minus 4 days within 28-day window. However, they also said that if someone does miss it for, whatever reason it is, do not restart the series. Just get the second dose in the series as soon as the patient is able to. And so that's all they really said. And, we don't really know any more than that, as I don't know any more than that, at least.
Okay. Question, Dr. Oliver, Dr. Whewell. Will there be mass vaccination sites in various communities, drive-throughs, gymnasiums? What is the vision for mass vaccination?
Yes, we'll do that, but that's a ways off. We got to get to the 500,000 in phase 1A, the 1.5 million in phase 1B. In phase 2, we branch out and start dealing with medically vulnerable populations. It will be what would you say, Stephanie? Next spring, summer, before we're doing those sort of mass vaccination things. But we're planning for it now. I mean, literally, we have local health departments that are setting up contracts and MOUs with fairgrounds, other sites for doing mass vaccination. We know that there will come a point in this campaign that we'll have to do that. But I think it's really important to underscore that part of the anxiety that some people are feeling about the vaccine right now is they know that it's here and they're wondering why they aren't getting it, or why a particular population that's at high risk isn't getting it yet. And the reason is because we don't have much of the vaccine available yet. And until that's true, that we have massive production of these vaccines, it's going to be difficult to do the mass vaccination. That's going to come, and hopefully the 2 vaccines we have now will step up their production, and the 4 that are still in clinical trials will finish those clinical trials, and 1 or more of them will be proven to be safe and effective.
We are out of time. Thank you to Christina Baril. There are some who has posted some very useful information about webinars and places to get information. Please give us your feedback on the panel so we know what else to plan. There's a link now in the chat. And I want to thank Dr. Oliver, Dr. Crawford, Dr. Rathobani, Dr. Good. Did I miss anybody? Dr. Wheeler.
And Dr. Klein, thank you.
And Donald Moore, who is the man behind the scenes. So thank you all for your participation. We're very grateful.
Yes, thank you.
Thank you very much.
Happy New Year.
Yes, everybody, Happy New Year.
Happy New Year. Thank you.
That was great attendance.
That was great. Yep.